There is nothing to worry about this undifferentiated and differentiated. You just tell that which joints are predominantly affected, because that is going to matter in the management. Because if there is axial spondyloarthritis, most of your disease modifying agents has no value. Your sulfasalazine, methotrexate, lefuronamide has no role absolutely if there is axial spondyloarthritis or only central joints are affected. But these drugs are of good help if you have a peripheral joint arthritis. So that's why it is important to know. So not to confuse people, they have made it very simple that whether this is axial or this is peripheral. But before putting this criteria, you have to be very, very strict with your entry criteria. You should not put all back pain into seeing that which is axial and which is peripheral. So inflammatory low back pain, again I have told you, chronic inflammatory means early morning stiffness more than 1 hour, young patient, improves with exercise, get worse after taking rest. Late night pain, many patients will tell you that 4-5 baje मैं उठ जाता हूँ, and after that it is very difficult. I am tossing and turning on the bed. Most probably these are spondyloarthritis. So not only early morning, I don't know what is your morning time, because for you 7 o'clock also early morning. So that early morning. So late night, so they will have problem by 2 o'clock or 3 o'clock. And 4 out of these 5 parameters are very, very important and insidious onset, because many of us may have gone to gym or something and tomorrow you will have back pain, you cannot tell that this is. And PIBD, prolapse intervertebral, is very, very confusing, because these patients also have a early morning stiffness. You ask your PIBD patients, they will tell that in early morning when getting out of the bed they are having bigger problems. So personally I have realized that, and they are also young patients. This prolapse doesn't happen to very old patients. This happen to young. So PIBD is a very, very close differential pain like spondyloarthritis. And if you have satisfied this entry criteria, then you have to search for SPF flavor. I always tell when to suspect spondyloarthritis. That flavor has to come, so you have to search for these symptoms. So 11 criteria are decided by ASAS as spondyloarthritis features. If you have these features, then you can tell that this is spondyloarthritis. The first one is already we have known, inflammatory back pain. Second is peripheral arthritis. You know, so because you must be getting confused with that Harrison table. How to remember all this? These are very simple actually, these are not complex. So one is arthritis, inflammatory back pain. Second is peripheral arthritis, oligoarthritis that we have described. Third is enthesitis. You know what is enthesitis. Enthesitis is inflammation of site of attachment of ligament or tendon to the bone. And what are the sites? It could be plantar fascia, it could be Achilles tendon, it could be tibial tuberosity, it could be anterior spine, it could be total crest, or it could be tennis elbow also. So normal myofascial pains, if attached to on this background also enthesitis. Okay. Next is dactylitis. So what dactylitis? Swelling of the digits or toes. And why this happen? So what is the difference between synovitis or arthritis and dactylitis? So dactylitis is synovitis plus tenosynovitis plus subcutaneous edema. So everything is swollen. Okay. And dactylitis happens in which diseases? Number one is, I call this more happen with reactive arthritis. The subset that we tell reactive arthritis or sickle cell disease. Very good. Number 3, chocolate for them. Number 3, we can tell. Psoriasis is spondyloarthritis. Okay, psoriasis is correct. Number 4, gout. Gout patients also can have dactylitis. Next is uveitis. Okay. Next is IBD. So whenever you have to take a case inflammatory back pain, then please start having that habit of writing. There is no history of ascites, dactylitis, psoriasis, uveitis, colitis. Then you will never miss spondyloarthritis features. Okay. Enthesitis. Write down enthesitis, dactylitis, psoriasis, uveitis, colitis. Colitis means IBD. Five features. Then your all itis are gone. Okay. The next is family history, because this is one disease which have a very strong genetic link out of all arthritis. So family history, if you have a family history, that is also a SPA feature. Next is good response to this is also a clinical test, and this will, you just keep this in your mind, this will help. A single etorecoxib tablet, you give it to a PIBD patient or any other back pain having a, you give it to a spondyloarthritis patient, there will be dramatic response. Not all patients, but good response to NSAID means this is also a feature, because most of these patients, they respond very beautiful to NSAID. So good response to NSAID. And two blood parameters, one is HLA-B27 positivity and number two is CRP, high CRP. No ESR, high CRP and HLA-B27 positive. So these 11 features are called as